Hello, everybody. Welcome to Happy Hormones. If you don't know me super well, my name is Andrea. I am a registered nurse with my Bachelor's of Science in Nursing. If you see me looking back and forth both ways, that's because I am also live on Instagram because I believe in making the most out of my time. So I'm going to talk to you guys today about lab testing because you guys have all had a lot of questions. These are questions I get all the time. And I have spent probably 9 hours in the last 2 weeks researching labs again so that I could articulate it in a way that makes sense to you. So first of all, I am a nurse. I believe that you can be a professional and still wear sweatshirts. So if sweatshirts give you the impression that I don't know how to take care of people or that I don't do a good job of getting people better, I don't know what to tell you about that. So that actually brings me to a question. Do you feel like you can't take somebody seriously if they're not dressed professionally, or do you find that you relate more to a practitioner if they are easygoing, down to earth, etc.? Let me know in the comments, okay? Hey, Kristen, thank you for joining. Katie, thank you for joining as well. Lindsay, Darlene, I see you. Please feel free to ask questions throughout this training. I may save them to the end because I want to make sure I get through all of this but if you do have questions, I will do my very best to answer them. Okay, so lots of questions about labs. How many of you have had your lab done and they all came back normal? Let me know in the comments. Let me know if you've had your labs done and they all came back normal. I'm going to explain to you why that happens, okay? Yeah, I'm going to talk to you about what labs to order, when to order them, and are they really necessary in order to get better? So couple things. So I learned this in part. Obviously, labs are a huge part of our training as nurses. We spend a great deal of time learning how to read labs, understand them. Let's see, Lydia says, my labs were done a while back and they did all come back normal. Okay, did they come back normal and you still felt like garbage? Maybe that's a better question. We do a lot of training in how to read labs, how to interpret them, how to provide treatment plans based on lab values. But one of the things I did not know that I learned through my own health crisis, my own hormone crisis, if you want to call it that, was that the foundation of lab testing as we know it is a little bit faulty. So I'm going to explain that to you. I've explained this in other videos, but I want to kind of go into a little bit more depth on what that means. So the thyroid panel, for example, is a bell curve testing, meaning that it literally looks like a bell. They tested all of these women. I believe it was some thousands of women. Lindsay says, first time came back low progesterone, then later on came back normal. Lydia says, absolutely, I know my body is so off even with lab testing. Okay, thank you ladies for sharing that with me. Okay, so the bell curve. The bell curve is basically they tested all of these thousands of women and came up with the lowest, this person tested with the lowest thyroid number, this person tested with the highest thyroid number, and this is the average, somewhere in the middle there. Okay, what they did not tell you in this testing is how are people feeling with these numbers. So you can be a 6, for example, which would be hyperthyroid. You can be a 6.5, and your hair's falling out, you have heart palpitations, you have anxiety that's through the roof. I would not consider that normal, and yet it's still considered normal because it's within this range, okay? You can have a TSH of 0.3, and that would be considered normal because it's in this range. However, you can be exhausted beyond belief, unable to get out of your bed, and not having regular bowel movements. So that's also not normal. You individually can have a spot on, dead in the middle TSH, thyroid stimulating hormone, and have low energy, have a low libido, your hair could be falling out. So what they're missing is they're not telling you what is functional for you as an individual. All they're telling you is that you fit on this graph of all the thousands of people that we've tested for thyroid issues. So I'm going to kind of give you a deep dive, and I hope that this makes sense, okay? And I want you to be thinking about, while I'm asking these questions, are your lab results actually getting you closer to overcoming your issues, okay? That's something I want you to be thinking about. So there is a difference between blood lab values, urine, and saliva. And what we have found is that blood testing, one, it gives you a snapshot of maybe what's happening in that 30 seconds that the IV is in your vein of all of your labs. Number two, it misses things like cortisol. It can tell you how much free cortisol is in your blood, but it's not going to tell you how much cortisol, which is your stress hormone, is being metabolized and used by your body, or if your brain is telling your adrenal glands to make enough cortisol, okay? So urine and saliva are preferred for cortisol testing because they can capture kind of what's going on below the surface of that cortisol. Is the cortisol, is it being metabolized properly? Is it free, meaning able for the body to be used or not? So these are things that I can pretty much guarantee you that your general practitioner is not going to know how to read them because it takes really specialized training to know how to read the symptoms, okay? Hang on, I think I have the wrong, I started on the wrong side, okay. Okay, so saliva shows a pattern of cortisol. The pattern is the most important. It is more important than the value. So what I mean by that is whether or not your cortisol rises in the morning and falls in the evening, okay? That is what we want to see. You cannot tell that by a lab test, by a blood test specifically. All you're going to get is one value of what your cortisol is. And again, they're going to say, oh, that falls within a normal range, so you're fine. The pattern is everything when it comes to your cortisol, okay? You can only tell a pattern by saliva or urine testing. So if you're not getting saliva or urine testing, you're missing out on a big piece of the puzzle there. Your urine metabolites. I'm getting a bazillion notifications right now, you guys. I don't even know what's happening. Let me turn that off. Urine shows metabolites, and the metabolites of your hormones, that I'm going to go into detail on what exactly the hormones that you need to be looking at. Sorry, I just dropped my Instagram. We're doing a great job over here, giving myself words of encouragement because I need them. Okay. Urine metabolites and saliva metabolites actually show us if your hormones are behaving properly. Not just is your body producing them, but are they behaving properly, okay? So the number one, I'm going to give you the list of the minimum labs that you need to look at if you're going to have lab testing done to facilitate forward movement and getting your hormones under control. Progesterone, number one. Estrogen, TSH, T4, reflex T3, thyroid antibodies, and cortisol. That is the minimum that you need to have looked at if you're actually going to get an accurate picture on your hormones, whether you're postpartum, perimenopausal, menopausal, postmenopausal, okay? Those are the minimum labs that you want to have drawn. And the reason is because we need to see the pattern and the relationship between the number values, not just the numbers on their own. Oh, your progesterone's normal, or oh, your estrogen's normal. Secondary to that, then, we need to peel back that layer once we have those values and see, okay, how is your estrogen being metabolized by your body? Is it going the safe pathway or the unsafe pathway that leads to cancer? And these can only be tested by urine. Okay? You can only tell that testing by urine testing. So what you need to know about progesterone and why this matters to you as you get older, your progesterone, I lost like a whole page of my notes and I'm really mad about it. So I'm just going to have to go off my memory. Okay. When you get older, you start to lose progesterone. Your body starts to make less. There are also certain circumstances. Let's see here. Lindsay, I might be able to type this up into some kind of format later, but probably not at the moment. But yes, I will do that. Progesterone, yay. It's the hormone of pregnancy. It's also the hormone that kind of bathes your brain in calm, okay? And that is because progesterone helps to produce GABA. GABA is a calming neurotransmitter chemical in your brain that makes you feel balanced. It helps you to feel like you can handle your stress and anxiety well. It helps you to sleep better, okay? It's the sleeping calm neurotransmitter. That's what I call it. Progesterone can be inhibited by damage to the pituitary gland, okay? You might be thinking, oh, I've never had a head injury. This would never pertain to me. Your pituitary gland is in your brain, if you don't know that. Your pituitary gland can actually be easily damaged by how your brain changes in pregnancy. So the brain physically changes in pregnancy and puts pressure on the pituitary gland. And that doesn't always go back after pregnancy, which is why some women have postpartum depression, because their pituitary is not functioning properly and it's not signaling for the progesterone to be made. The other thing can be getting whiplash in a car accident. Even if you're just rear-ended, that can be enough pressure to slightly damage the pituitary so that it's not producing progesterone. Progesterone can also be damaged by, what was the other one? Just age. We start to lose progesterone as we get older. But there are natural things that we can do to increase our production of progesterone. The second lab value that you want to before is estrogen, but not just are you producing estrogen or is it too high? You actually need to have somebody who can look at, again, the metabolites, so estradiol and estrone, because how the estrogen breaks down is just as important as whether or not you're producing it or if you're producing too much, okay? So estrogen, now this is fascinating to me. When I was looking through the research again and going through some of my old trainings, estrogen, estradiol, and estrone, which are like estrogen's BFFs, we'll just call it that, are converted from testosterone and then detoxed by the liver. So having your testosterone and your estrogen tested are actually really important because we need to see, again, the relationship between the two values. It is detoxed by your liver, cleared in your bowels, meaning your liver helps you to poop, and then you poop out the estrogen, and any that is not cleared by the bowels is then reabsorbed by the body, and this causes DNA damage and cellular growth, like cancerous growth, specifically estrone. So when estrogen is not broken down properly, then estrone is not broken down properly. It's reabsorbed by the body. This is what we call bioaccumulation, and it leads to toxicity, cellular damage, and cancer. This is why it's really important then, if you're going to have your estrogen tested, that somebody just doesn't see that high estrogen number and say, okay, we're going to do something to stop the production of estrogen, and then you're not detoxing any of it, and they're not looking at, okay, but is it the healthy estrogen pathway or the unhealthy estrogen pathway? You need to have somebody who can look at both of those, okay? Let's see here. Melatonin. So this is something that, like, I actually never had tested, was my melatonin and serotonin, but now what they see in these like complete urine panels is if you looking at the melatonin and serotonin pathways. So melatonin is, as we know, it's what helps you fall asleep. It makes you go to sleep at night. It helps you to stay asleep at night. Melatonin is made, again, by the pineal gland. So if the pineal gland has been damaged by, getting a head injury, or let's say you were pregnant multiple times back to back to back, the pineal gland can actually shrink because of that, or just by old age. You're not going to be able to convert or produce melatonin, okay? So serotonin is the happy hormone. It makes you feel like you have energy to get through the day. It helps you to feel alive and energetic and like you can pursue the things that you desire. So serotonin is also made by the pineal gland and helps to produce melatonin. Now, what I want you to understand about serotonin is that it naturally drops right before your cycle. So this is why a lot of women tend to see like an increase in PMS symptoms, depression, anxiety, and sleep issues because their serotonin is dropping off. And that is because of the pineal gland. So none of this stuff, I can guarantee you, I'm actually going to ask you guys, how many of you have had your doctor, when they do these lab tests, talk to you about your serotonin or melatonin? I want to know. Or did they just prescribe you the pill because that will take away all of your symptoms without addressing the HPA axis, which is the, I'm forgetting the fancy words, but the HPA axis, which is the pituitary gland and how it signals your adrenal glands and your other hormones. Let me know in the comments if you've ever had anybody address that with you, okay? Okay. So serotonin and melatonin are those metabolites of the other hormones that you would be having tested, okay? Estradiol is a metabolite of estrogen. So we're going back to estrogen now, and I'm sorry that this is a little bit out of order. I had my notes all organized, and now I can't find them. So I'm just gonna go off my old notes. Estradiol, so this is why it's important, again, not to just have your estrogen tested. Let's see here. Lindsay says, none, they just gave me progesterone cream and a lozenge. Yep. Pretty common, I know, so sad. Or they'll prescribe you an antidepressant or something for that time of the month without realizing it's not actually your serotonin that's the problem, it's the pineal gland and the HPA axis, sorry. So, okay, so there are two pathways that estrogen takes in the body, and every woman's a little bit different, and they're finding out more and more about this as it pertains to reproductive cancers. So there's the estrone pathway and the estradiol pathway. Estradiol in particular provides cardiovascular and bone protection, okay? So this, again, estrogen in general can decrease with age, but depending on your toxicity level, how well your liver breaks down hormones, how well your gut gets rid of hormones, how your methylation is, we're going to talk about that in a second too, can really determine whether or not your body is able to hang on to that estradiol so that you have the cardiovascular and bone protection. Now, what I want you to know, if you don't remember anything else from this training, it is the relationship between all of these labs or the ratios that is the most important. So if your doctor is just looking at singular values because that's all that they know how to do and that's all they've been trained to do, they're missing some key pieces to actually helping you get better. Okay, so what they have found in numerous studies, is that bioidentical hormones, even if they replace, let's say you have low estrogen and you have low progesterone or you have high testosterone on one of your tests, and they replace it with a bioidentical hormone, it leads to an increase in estrogen metabolism in the negative pathway. So remember how we talked about a positive estrogen pathway and a negative estrogen pathway, okay? It increases the estrogen metabolism in the negative pathway, which leads to an increased cancer risk, cysts, and fibroids. So bioidentical hormone replacement therapy is not right for everyone. So if that is your go-to for your doctor who's like, your estrogen's low, your progesterone's low, we're gonna do hormone replacement therapy, and they haven't looked into which pathway your body goes down, that's a problem because it can actually increase your risk later on for reproductive cancer, which is, we don't want that. The other thing that they have found with bioidentical hormone replacement therapy is that it does not provide the protective benefits of plant-based therapies, okay? So that's something to think about. Is your doctor well-versed in this? Do they know what alternative therapies to provide that do provide you that long-term protection that you need, okay? Hang on here. Okay, sorry. Feel free to keep asking your questions, you guys. I'm just trying to catch up here. Okay, the other thing that most lab values do not look for, okay, is methylation. So a lot of times when I'm explaining how the liver works in detoxing hormones and, well, if my liver was damaged, why didn't it show up on my liver panel? Well, your liver panel is actually just testing how well your liver is filtering and processing blood. It's not telling you how congested it is, meaning how overloaded is it with toxins? Is it able to break down vitamins and nutrients? It's literally only telling you how quickly is the blood flowing and getting out of the liver and getting through all of the cells in the liver and out into the digestive tract, okay? So that's the number one question I get when I start talking about balancing your liver and how important that is for healthy hormones. So what they need to be looking at, the liver function panel doesn't really tell us anything regarding hormones. The methylation, your methylation status, so whether or not you have the MTHFR mutation or a few other mutations, how you process B vitamins, that tell us about your methylation status. So methylation status can show you how well your liver is working because the liver detox helps to eliminate excess estrogen and metabolites. It also helps to convert your B vitamins so that they are in a usable form so that your body can take those B vitamins and make the neurotransmitters like serotonin and melatonin. Is this all kind of starting to make sense? I know this is confusing. Eventually, I will make it into some kind of PowerPoint that's easy to visualize, but I'm trying to help kind of put all the pieces together for you, okay? Low methylation, which is, we estimate about 50 to 60% of the population has some genetic variance where we don't methylate properly, meaning you have either it's called a COMT mutation, COMT mutation, or an MTHFR mutation are like the two primary methylation factors, okay? Low methylation equals low estrogen clearance, which means that your body is then not metabolizing and breaking down estrogen, and you are more likely then to be in that negative pathway of estrogen that will lead you to problems down the road like reproductive cancers and DNA damage. All right, metabolized cortisol. Okay, so this is a big one. So a lot of times women will go thinking like, oh my gosh, I'm having all this stress and anxiety. I must have too much cortisol. Well, stress and anxiety can be caused by numerous things, including side effects from birth control, even long-term side effects, even if you've been off birth control for a really long time, because those damage your ability to take up B vitamins, number one. But they'll go in and they'll have their cortisol tested, okay? And their cortisol is normal, but they're still either really fatigued or really anxious. There's kind of like two ways you can go with that. Well, what they need to be looking at is not just, again, the pattern of cortisol. So do you peak in the morning and then gently kind of decline in the afternoon? But is it free cortisol, meaning that your body is actually producing the amount by your adrenals, free for your body to use? Is your brain telling your adrenal glands to make the appropriate amount of cortisol? Because that has a huge impact on how you feel and how your hormones are going to behave. So that's one of the other things that they need to be looking at if they're looking at your labs, okay? One of the other key pieces that they're often missing in these labs is actually looking at inflammatory markers. So inflammatory markers would be your, it's right there in my head and I'm missing it. I wish one of my nurse friends was on. Oh gosh, okay, I'm gonna have to type it up later. So inflammatory markers, easy to test, not hard to look at, but inflammation in the body leads to high metabolized cortisol, which leads to more fatigue. So looking at all of those markers, all of those metabolites versus, let's see here, Liz says, if your pituitary is damaged and then you're having to take medication for brain injury, I'm sure it could cause a mess in your body. Yes, definitely can, for sure. Okay, so some questions that I would be asking if I was looking at all of these labs via the correct, testing with saliva and or urine is what do the relationships look like? So these are the questions that I want you to ask yourself above and beyond what labs do I ask for is, hang on, I want to back up for a second. Beyond what labs, I'm telling you guys, like my brain just fell out of my head. The labs that you test for. Okay, so when should you do lab testing? So the fascinating thing is that we can actually do so much to get rid of all of these symptoms without ever having your labs tested. So how I use lab testing in my practice is if we are dealing with all of the root causes, so diet, stress, sleep, liver, gut, supplementation, we're dealing with all of those and we're not seeing any improvement, then I want to be able to do a deep dive into somebody's labs and see what's missing. Because it may not be the estrogen, it may not be the progesterone, it may be the pituitary isn't communicating with the rest of the body. So we need to do some things to make that happen. So I personally use lab testing very little because it's not necessary, because we are dealing with all of those root causes, those underlying root causes that are leading to all of the symptoms that you're having. I do find it useful, like I said, if I have a client who we're really stuck and we're not seeing progress and we need that data. Like I need to be able to see, is her liver metabolizing? Is it methylating properly? Is she having a normal peak of cortisol or not? Like those kind of things really help me to pinpoint some target areas. But I will say that for 99.9% of my clients, we don't need to, because we're dealing with all of those root causes. So if you're watching this and you're wondering, well, where do I get this testing and who's going to read it? I'm going to give you some pointers for that, okay? So a couple questions I want you to consider if you are wondering whether or not you should get your labs done, or you are not sure how that's going to go, or you've had a bad experience in the past, okay? So number one, are your lab results going to bring you closer to overcoming your issues? Meaning, if you go to your doctor and you have your labs drawn, are they going to have a plan in place, for restoring the function that is causing these labs to be abnormal, or are they just going to offer you hormone replacement therapy or surgery or say that you're crazy? Number one, that's the first question to ask. Does your practitioner who is reading the labs understand them and know how to address them without medication, for example? So diet, stress, sleep, are they using those as methods of eliminating your symptoms? That would be another question I would ask. Does the practitioner reading them understand ratios and relationships between lab values, as well as understanding the difference between serum, blood, urine, and saliva? Because you're only going to get a little snapshot with blood, okay? Do they understand, like I said, the difference between saliva, blood, and urine, okay? This is what I want to leave you with. Will knowing these lab values provide you a solution to getting better, or is it going to just keep you on the hamster wheel that you've been on all of this time? These are things that you need to think about. I can tell you that with the clients that I work with, I don't need to do lab testing. I can count on one finger the time that I've had to do lab testing in the last year. That's 1 out of maybe 100 clients. So it's not necessary. We use it as a tool if the work that we're doing with all of the foundational pieces is not working. But my goal with this is to, 1, provide you some information on lab testing, 2, so that you know what to ask for when and if you need to go to the doctor to have your labs drawn, and 3, provide you a solution for moving forward. So if you are tired of being on the hamster wheel and you are tired of going around the merry-go-round of lab testing and medication and lab testing and medication and lab testing and medication and no improvements, or you're even working with a functional medicine doctor and you're doing lab testing and then you're tweaking one hormone at a time, then I would invite you to book a breakthrough call with me. These are completely complimentary calls, but it allows me to pinpoint exactly where you're stuck, what is not working for you, what is working for you. And so then we can come up with a strategy and a plan to help you move forward. So again, I will type up some of this information and put it in a readable format sometime later today or maybe tomorrow. Please feel free, if you're watching the replay, to let me know if this helped you or not. And I'm going to drop a link to book a call. I am almost booked up for the rest of this month, so quickly, but I would love to chat with you if you are just done with the merry-go-round. Let me help you. I hope you have a great rest of your day, and we will be in touch.